Esposito here. Welcome, folks. I'm Dr. Joe Esposito. Glad you can be with us today. I'm going to talk today about food-drug interactions. This concerns me because a lot of people on medications and they having food-drug interaction, they don't know it. So the way we do this is I'm going to talk for 24 minutes. At the end of 24 minutes, whatever platform you're on, you can type in any health question throughout that 24 minutes. John and Julia, my producers, will read me the questions. I'll answer them, and then we'll do another 24 minutes, and then we'll answer questions again. So it's a real simple process. Great time to have any of those health questions answered because all of us have health questions, and now you have an opportunity to have them answered. So I'm very happy that you could be here, and we're ready to start whenever you are, John. Ready? Hey, folks, Dr. Joe Esposito here. We're going to talk about today's food-drug interactions. A big concern of mine because most people, a majority of people, are on medications. 60 to 70% of American adults are on at least one medication. That's a lot. Up to 25% are on 3 or more medications, and 89% of adults over 65 are taking medications right now. That's a lot. If you're taking 5 or more, it's called polypharmacy. That means you're taking so many that you even have your own name for it. And the challenge we have with this is not don't take the medications or take it. The challenge is there have been no tests on interactions between all these medications. I can't say no. There have probably been some tests. But if you take medication A and B, what happens? What about A, B, and C? What about A and C? So we don't know what's going to happen with these drug interactions. And then on top of that, we add food-drug interactions. You may be eating foods that are either making your drugs work better or worse. For example, a grapefruit can affect the medications and make some of them less effective and sometimes make them more effective. If they're more effective, that's a problem because then you have to deal with dosage. And I wish this was addressed, but I don't hear it ever being addressed. And it worries me because so many of you, like I said, if you're over 65, 89% of people are taking some type of medication in the past year, that is a concern. So let's talk about some of these food-drug interactions. And while we're going through that, I'm going to say, listen, if you're taking a drug for a certain condition, what if we work on getting to the cause of that condition so maybe you don't need the medication? I'm not saying don't take the medication. I'm saying if you can get yourself healthy enough to not need the medication, that would be my goal. And most of you would have that same goal because you come to me every day and say, hey, Dr. Joe, what can I do for my anxiety, depression, my sleep issues, my high blood pressure, my diabetes? Let's talk about that. So the number one medication I see people taking is blood pressure medication. Number 2, cholesterol medication and diabetes medication. They're probably tied for 2. So let's cover those 3 biggies. Certainly got to do that because I know we got a lot to cover. So if you're taking statin drugs, how many people take statin drugs to lower your cholesterol? A lot of you do. If you eat grapefruit, it can raise the drug level, and that can cause liver and muscle damage problems. So it actually makes it more effective, which you don't want really. So how many of you like grapefruit? I do. A lot of people do. If you're on medication, the one drug, one food, spoiler alert, that's going to have the biggest impact is going to be grapefruit. And that goes for grapefruit seed extract as well. And the reason I started with this is I got an email from a patient this week, well, not a patient, from a listener this week, and I get a lot of emails from you guys. And somebody said, does grapefruit seed extract have an impact just like grapefruit? And the answer was yes. So you might be taking this holistic grapefruit seed extract, and it could be affecting your medications. So what do we do about it? Number 1 is just eat different fruit. Okay, there's apples, peaches, pears, bananas, pineapples, mangoes, kiwi, starfruit. So many different fruits you could eat aside from the grapefruit. I know you like it. Can't do it if you're taking medications. Also the same thing with birth control pills. Be very, very careful. It can affect birth control pill effectiveness. But if you're taking statin drugs, it affects a liver enzyme, and there's a pathway that goes around, and it lowers your cholesterol, but that same enzyme pathway produces something called coenzyme Q10, CoQ10. CoQ10 is necessary to get into the mitochondria of the cell and make the mitochondria generate electricity. Mitochondria are little inside the cell, they're parts of the cell, and they're called the powerhouse of the cell. And to tell you how important they are, a brain cell has about 20,000 mitochondria per cell. A muscle cell might have 10,000. So mitochondria make the cell, feed the cell electricity. Because we're not plugged into the wall, we got to get our electricity from somewhere. we get it from the mitochondria generating electricity. CoQ10 is necessary to make the mitochondria work, to generate electricity. So if you're taking statin drugs, you're lowering your cholesterol, you're also lowering your CoQ10 production. And that becomes a problem. Because a lot of people on statin drugs will say, Dr. Joe, I'm just so tired all the time. I'm so weak. I want to work out. I want to clean house. I can't. I just don't have the energy. It may be due to the mitochondria lowering their production of electricity due to CoQ10. So, what do we do about that? If you're going to take statin drugs, and I can't tell you to take drugs or not take drugs, make sure you take a CoQ10 supplement. It's a real quick, easy, inexpensive solution to that. But it doesn't solve the problem. Why do I have high cholesterol? Have you ever asked yourself that question? Why do I have high blood pressure, diabetes, thyroid issues, whatever it is? Why do I have it? Sometimes it's genetic, but sometimes it's something you can control. And in many cases, whether it's genetic or not, taking certain steps should help dramatically with your overall health. So if you're taking statin drugs, I want you to consider taking your CoQ10, but then changing your diet. I know that's a big ask. Changing your diet is a biggie. But just making small changes in your diet can dramatically lower your cholesterol levels. Number one, cut out or cut back on your meats and dairy products, because meats and dairies can raise your cholesterol levels. Now, if you're going to do meat and dairy or eggs, I recommend organic only. Because even 20, 30 years ago, we didn't have to worry about steroids, chemicals, hormones, antibiotics, genetically modified food, glyphosate. It's a very different world today than it was even 20 years ago. So if you're going to do it, make sure you do organic for animal products. It's a simple fix, really. Now, I prefer you don't do it, of course, but at least cut back on it. The less you do, the better off you'll be. Now, there are people out there that are waving a flag, oh, you got to eat a high-protein diet, you got to eat all this meat. I went to Lake Lanier, which is a big lake in Georgia here, and I was with a bunch of people, and I was trying to keep a low profile, but unfortunately, a lot of people recognized me. And, of course, the question came up, where do you get your protein? I get that question all day, every day. Well, you don't eat meat. Where do you get your protein? You only need about 8 to 10% of your total caloric intake is protein. The rest of it is really wasted. So you can eat more protein, and yes, you're going to feel full. You're going to eat less carbohydrates, less junk food, and you'll probably lose weight. And you'll be good short term, but long term, the studies are not very positive on a very, very high protein diet, especially on the kidneys and the liver. They just kind of beat up your kidneys and your liver. So you don't need animal protein to build protein. And ask yourself a question. Where do cows get their protein? From plants. Where do horses get their protein? Where do elephants get their protein? So it's not like they're eating animal protein to build muscle mass. And the biggest, strongest, longest living animals generally eat more plants than animals. So you might want to consider taking a call from nature. So if you do something simple like that, make sure you're eating a lot of fiber. Because fiber pushes the food through your colon and can flush out excess cholesterol. Once again, what do you eat? Where do you get fiber from? Eating more fruits, vegetables, nuts, and seeds. So giving up your grapefruit, important if you're on statin drugs, but then replacing it with other fruits and vegetables solves a lot of your problems. In many cases, can bring down your cholesterol levels. Wouldn't that be cool? So just a thought. Again, I'm not telling you to stop your medication. Do these in addition to that and see what happens. Another medication I see a lot of people taking is high blood pressure medication. How many people take that? A lot of you do. Okay? So if you're taking blood pressure meds, guess what? Grapefruit, once again, can affect it. The blood pressure can drop too low if you're taking grapefruit. It goes along if you're eating arugula, if you're taking beets. These contain components that increase your production of nitric oxide. Nitric oxide is a gas. It's in your blood vessels. We all produce it. And when you're older, you produce less nitric oxide. So the blood vessels don't open like they used to. And so the blood vessels remain tighter, less flexible, raises the blood pressure. So we have a supplement called Dr. Joe's Nitric Oxide Support. And we have another one now called Dr. Joe's Chewable Energy. And both of them contain citrulline, which converts into nitric oxide. Nitric oxide opens up the blood vessels. Pretty exciting. So I tell people, if you have high blood pressure and you're on medication, if you take Dr. Joe's Nitric Oxide Support or Dr. Joe's Energy Chewables, monitor your blood pressure. If the blood pressure goes too low, you have to make a decision. Do I want to cut out my supplements, or do I want to go to my provider and say, hey, maybe it's time I cut back on my medication? Well, I know the answer because people do it all the time. They go to their provider and say, can I cut back on my medication? And in most cases, a smart provider is going to say, yeah, if your blood pressure is coming down, you don't need so much medication. We've had a lot of people come off their medication just by taking things like citrulline, Dr. Joe's nitric oxide support. Peanuts will do the same thing. Peanuts are high in arginine, and arginine also converts into nitric oxide. But one of the things you have to worry about with peanuts is they're high in arginine, which can stimulate herpes outbreaks. Now, there's many, many types of herpes viruses. There's oral, there's genital, there's shingles, but there's other types too, and viruses like arginine. So peanuts will open up your blood vessels and lower your blood pressure, but you have the effect of arginine. I don't want you doing that because everybody has some type of herpes virus in their body. And again, not just the genital, the oral, there's different types. So I'm not a fan of peanuts as a way to lower your blood pressure, but arugula is great. Beets are good, but arugula has more nitrates in it than than beets. So arugula is actually the number one food for lowering blood pressure. But I take supplements every day. I take citrulline every day, and I take the energy boosters every day. But I monitor my blood pressure. If it goes too low, I take in too much. But one of the benefits of Dr. Joe's nitric oxide support or citrulline opens up the blood vessels to your brain, your heart, your reproductive organs, your liver, your spleen. I get this burst of clear energy. I was at this party the other day up on Lake Lanier, and I brought some of my chewables with me, and I handed them out to my friends. And everybody except one guy said, wow, those things are amazing. I felt great. Where can I get more? Well, they're on the website, drjoe.com. But one guy said, I took it and nothing happened. Well, he was a portly fellow, to be polite, and he had high blood pressure. And so he was probably so deficient, I'm guessing this, in nitric oxide that a regular dose wasn't enough for him. We would have to up the dose for him because he was a bigger fellow with issues already. But I love the nitric oxide supplements. Take them every day. Great for pre-workout because they give you a burst of energy. Post-workout, increase circulation to break up lactic acid so you don't hurt as much. And if nothing else, it gives you energy and clear thought too. I take them before every show, every podcast, every lecture because I want to make sure my brain is working the best it possibly can. And I want my brain working every day anyway. Because I was out with my friends. I'm not the oldest. I'm probably right in the middle, but I'm by far the youngest looking. And the topic came up on multiple occasions. What about brain function? I'm starting to forget things. I'm getting senior moments. I walk in a room and my brain isn't working like it used to. Yeah, the brain does decline as you get older, but let's fight that. And one thing that, as part of a protocol, would be Dr. Joe's nitric oxide support and or the energy chewables. So we're talking today about food-drug interactions, but more importantly, what can we do to help lower the risk of having that condition that I need the drugs for anyway? Blood pressure many times is related to digestion. The nerves that control your digestive system are called parasympathetic nerves. Sympathetic nerves speed you up. Parasympathetic nerves slow you down. Blood pressure, if you're speeded up, raises. If you're relaxed, goes down. So many people, the digestive system isn't working. It's affecting the parasympathetic-sympathetic balance, and it raises your blood pressure. So if that's the case, we need to kick in the parasympathetic nervous system. And we can do that by fixing the gut. So you have acid reflux, heartburn, burping, gas, bloating. Many times, it's the stomach pushed up into the diaphragm. And we can physically manipulate or pull the stomach away from the diaphragm, activating the parasympathetic nervous system and helping bring down the blood pressure. So many times when I see people with high blood pressure, it's not a chemical problem, it's a physical problem. And we try to treat it chemically, and it doesn't work. That's why so many people are on different medications, 2, 3 blood pressure medications, never getting to the cause of the high blood pressure. I mean, sometimes you need it. Sometimes there's issues that occur. But what if we try everything we can to naturally bring down the blood pressure? Let's fix the digestive system. Let's pull the stomach away from the diaphragm. You can simply put a hot pack across your abdomen, which will activate the parasympathetic nervous system, and many times that brings down the blood pressure. You can actually put gentle pressure on your carotid arteries, gentle pressure, and that causes a vasovagal response, which kind of kicks in the vagus nerve, which is a parasympathetic nerve, which brings down the blood pressure as well. So getting to the cause of the problem is always the goal. But in the meantime, we have to address, if you're taking medications, what to do about it. I always want to get to the cause. So if you have an issue, I'd love to be your doctor. let's talk about pain for a second. If you have neck pain, back pain, shoulder pain, numbness, tingling, that can raise your blood pressure. But I want to get to the cause of the pain. So what's the most effective, least expensive treatment for pain? Chiropractic care. So why wouldn't you do the most effective, least expensive treatment for anything? Certainly when it comes to your health, healthcare prices are going out of control. Insurance companies getting worse and worse. I just saw State Farm lost a big lawsuit against how they evaluate the value of people's cars after they get in a car accident. It was 37,000 people, I think, in this lawsuit. Yeah. So insurance companies, their goal is to keep money and not pay your bills to a point. I'm not saying they're evil, but they certainly want to make more money and not pay you as little as they can. And sometimes that can be even deadly. I'm not going to pay for your treatment. You can't afford the treatment, and people have very serious consequences. So let's go with the most effective, least expensive for pain. If you have pain, go to my website, drjoe.com. Make an appointment to come see us. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. I want to be your doctor. I want to help get to the cause of your healthcare problems. So we can work on the nervous system. We can work on the digestive system, work on the diet, and let's see, with all these different things we have here, how many of the medications will get you well enough so maybe you don't need the medications. So if you want to make an appointment, drjoe.com, drjoe.com. Normally the first visit is $940. I've reduced that to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. Who does that? Nobody. I don't know of any doctor anywhere in the world that does all of that. That's why I want to be your doctor. So drjoe.com. And we accept most insurances too. So if you're just tuning in, I'm Dr. Joe Esposito. We're talking today about food-drug interactions. Let's talk about anxiety meds. Once again, guess what? Grapefruits. And so you got to be careful with grapefruits if you're on anxiety meds because that can affect the medications as well. Heart rhythm issues. Well, grapefruit again. We got grapefruit. I listed grapefruit as the top ones right away. Many times if you have heart palpitations, AFib, atrial fibrillation, irregular heartbeat, it can go back to the same thing we talked about with blood pressure. Could be a digestive problem. If the stomach is up against the diaphragm, if you have gas, bloating, diarrhea, irritable bowel syndrome, Crohn's, colitis, all these can be irritating to the digestive system, which can affect the sympathetic, parasympathetic balance. You got to fix the gut. And I'll tell you my personal story on this. One of the earliest memories I have, laying in bed as a child, I was probably 4 years old, 5 years old. And I remember laying in bed and my heart just racing, and then stopping and then starting again, and boom, 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 boom. Totally irregular. Well, I was a 4-year-old kid. We were very poor. My father was disabled. We lived in a small apartment. And I just figured that's how your heart works. I didn't know any better. And so once I became a doctor and graduated, and I realized that it was affecting the digestive system, I always burped a lot. Had always bulging belly. So I was bloated all the time. So once I realized you can fix the stomach, my belly flattened out, my burping went away, breath freshened up, and I don't have any more irregular heartbeats. So it wasn't a physical problem. It wasn't a chemical problem. It was a physical problem. So that's why I want to be your doctor. Allergy meds, same thing, grapefruit. Transplant meds, grapefruit. But blood pressure meds, let's go back to that again. Pomegranate juice. And this is kind of funny because pomegranate juice can actually lower your blood pressure. Arugula can lower your blood pressure. Beets can lower your blood pressure. So if the doctor does a full analysis on you, and I don't know any who do, they'll say, okay, Bob, you're on blood pressure medications. I don't want you to do any pomegranate juice, any beets, or any arugula because that can actually lower your blood pressure more. Well, what if we got to the cause of the blood pressure and did more arugula, beets, and nitric oxide supplements? If we can bring down the blood pressure naturally, wouldn't that be cool? Well, that's not how the system works, and that's okay. There's nothing wrong with that. There's a business model that's being run for your health care, but if we break out of that business model, now we can start to maybe shake it up a little bit. So if a good doctor is going to tell you if I'm on blood pressure medications, what foods can lower my blood pressure, they would tell you not to eat them. I would say eat them and monitor your blood pressure. And then let's see if you can cut back on your medications. So we're using food as medicine, not instead of, in addition to. And that's getting to the cause. Different approach to healthcare. I know most people aren't into that. ACE inhibitors, that's another thing. orange juice and bananas, it can give you a potassium overload. So just be careful with your intake there if you're taking an ACE inhibitor. Again, it's a blood pressure medication. Warfarin is a blood thinner. And I have people come to me, and they'll say, Dr. Joe, I want to take Dr. Joe's Essential Source, which is the #1 supplement you should take, by the way. It's prebiotics, probiotics, digestive enzymes, complete multivitamin, fruits and vegetables, all in a powder form. And one of the things it has in there is vitamin K2. And vitamin K2 and vitamin K1 can actually help your blood clot more efficiently. So if you're on blood thinners, they don't want your blood clotting, so they take you off the foods that you need to help get the body healthy enough, so maybe you don't need the medication. It's kind of an Elvis Presley thing. I'm caught in a trap. And it really is. So I tell people this: if you're going to take Dr. Joe's Super Greens and Dr. Joe's Essential Source and you're on a blood thinner, tell your doctor this: I'm going to take these supplements every day. I want you to monitor my blood and see if it's affecting me, if it's causing my blood to coagulate harder, and then I can cut them out. But you need to monitor my blood. And a good doctor is going to be monitoring your blood anyway. I've never had a patient come back to me and say, the doctor told me to stop taking it because objectively it showed up on my blood work, that it was affecting my clotting abilities. So that's why, yes, I understand vitamin K can increase the clotting, and vitamin K1 is a little different than vitamin K2. K2 isn't as effective, isn't as impactful as K1, vitamin K1, on blood clotting, but it lasts in the blood longer. So that's why most people don't have a problem with taking vitamin K2. Another thing, and this is kind of the irony of it all, is that if you have clogged arteries, one of the things vitamin K2 does, it takes the calcium from your blood and brings it into the bones. So we want to put you on a blood thinner because the arteries are so clogged up, but nobody's talking about cleaning out the arteries. So there's another catch-22. K2 can help clean out those arteries. Not saying it's the end-all, be-all, but if you're going to do that, just monitor your blood. Just talk to your doctor. You're getting your blood tested anyway. Just tell the doctor, I'm taking these supplements. Let's monitor it in a month and see what happens. But I want to clean out those arteries. I really do. And so vitamin K2 can do that. That's why I never recommend you take vitamin D3 without vitamin K2. Because one of the things vitamin D3 does, it helps absorb calcium into the blood. K2 takes it from the blood and brings it into the bones. That's why Dr. Joe's vitamin D3 with K2 is one supplement. Vitamin D3 is really a hormone. It does so many different things. Immune system, bone health, brain health. But it absorbs calcium into the blood. K2 takes it out of the blood, brings it into the bones. So if you're on blood thinners, just tell your doctor that you're taking this, and let's see what they say. So if you're just tuning in, I'm Dr. Joe Esposito, and we're talking today about food-drug interactions. I want you to understand that the food you're eating can adversely or positively affect your medication. And you need to be aware of these things. Now, I am not going to have enough time to cover everything I have on this list today. I've got a lot to cover here, and I'm not even going to be close to covering it all. So what I want you to do is, if you want a copy of today's show notes, and I think you should have this because you could look up your medication and say, oh, that's something I got to be careful with. Go to my website, drjoe.com, drjoe.com, and just send me an email. It'll say, ask a question. On the bottom, it'll say, contact us, little bots in the bottom right-hand corner, any of those. And all you have to do is say, send me today's, what I want you to do is put food-drug interactions in the email, in the title, and I'll send you today's show notes. Happy to do it, absolutely free, no charge, but you need to know these things because I don't know anybody else who's going to go over this with you except me. So, drjoe.com. If you have any questions, any health questions, send them to me through the website, drjoe.com. I am happy to answer your questions for you. Any health question. I'm usually got an answer for you. Not always, but usually. Follow me on social media. We post every single day. Dr. Joe Esposito, Facebook, the Dr. Joe Esposito. Facebook, Instagram, YouTube, TikTok, LinkedIn. If you like the podcast version, go to your podcast service and type in Dr. Joe for the health of it. Dr. Joe for the health of it. And you'll have podcasts. We do 2 podcasts a week, but all of them are archived there by title. And also on my website, we have all of our shows, radio shows, TV shows, all archived. Go to the bottom of the homepage. It'll say Dr. Joe Show. That's a Sunday night live show, and then the podcast is there too. I got to take a break right now. Don't go anywhere. We're going to be right back. All right. Is this too confusing today, John? It's okay. It's not too. I'm not getting too. Okay. Sometimes I get a little too deep here. I know what I'm saying. I don't want to confuse everybody else. So, what do you got?
I eat a good diet and I'm at a healthy weight. Why do I still have high blood pressure?
It could be physical. Weren't you listening? It could be physical. It could be acid reflux. It could be digestive issues with the parasympathetic sympathetic imbalance. Could be a pinched nerve in your neck affecting the vagus nerve. So if you're doing everything right, then it's something else. And many times in cases like yours, it's physical. So you'll need to come see us and we can do an evaluation for you. I can't give you an evaluation. I can't give you advice on that. I got to check you to see if you have the problem. So just go to drjoe.com and book an appointment. We'd love to have you. What else you got?
Are overripe avocados still okay to eat?
To a point. Depends what you mean by overripe. If they taste bad, don't eat them. That's a real simple rule right there. I mean, they could be a little soft, and that's okay. When they start turning black, it's probably not a good idea. So, avocados are only ripe for like 10 minutes, so you got to hit that perfect time there. What else you got, John?
What causes excessive earwax?
Excessive earwax. Your body is probably, and again, this is a guess right now. This is not a scientific thing. Your body's trying to protect those ear canals. Your body usually is adaptive. And so one of the things that can cause excessive earwax buildup actually is a jaw problem. Because when you chew, the motion of chewing pushes the earwax out of the ears. So if you have a locked up jaw, it's called TMJ, temporomandibular joint problems, that could be an issue. It could be that you might have an infection in your ear. Your ear's trying to correct it. But you got to be careful with earwax. Go to, what's the name of it? Can't think of it. There's like one company, I think, that makes little syringes and you could squirt it into the ear and break it up. They use hydrogen peroxide. Use something safe like that from a drugstore. Don't stick a Q-tip in there. Q-tip can push it in further and can really damage the ear. Never, ever put a Q-tip in your ear. So I would say if that's the issue, just get a flushing earwax. Oh, God, what's the name of it? I can picture it. Anyway, but get that from a drugstore and flush out the earwax that way. It's much safer. And if you have a jaw problem, come see us. We may have to adjust your jaw. What else?
Is there a natural remedy for psoriasis?
Yeah, psoriasis, most skin conditions, psoriasis, eczema, seborrhea, most of those are due to a liver problem. I get this question about 2 or 3 times a week on my website, drjoe.com. So what I'll do is I'll say, listen to the show I did on liver issues. But the 2 foods you want to cut out are going to be wheat and dairy products. No wheat, no dairy. Cut them out of your life. That oftentimes brings down the inflammatory reaction in the body, and after about 6 to 8 weeks, you start to see the skin start to clear up. So I'd say no wheat, no dairy. Try that, or send me an email, and I'll send you a show I did on liver issues, and I'll put together the whole protocol for you. But wheat and dairy's got to go. What else?
That is all.
All right, good deal. Take another sip of my magic tea. Here? More? All right, good. Yeah. Yeah, and if it's join the show or something, John, just I'll get it, There, I'll put this in front of me here. All right, where was I? Okay, good. All right, we're ready. Hey, folks, Dr. Joe Esposito. Thanks for staying with me. If you stayed, if you just joined us, welcome. What we're talking about today are food-drug interactions. The medications you're taking can be affected by what you eat. And very few people talk about this. You might get one little tidbit here and there, but it's not often talked about. So let's talk about antibiotics. If you're taking antibiotics, don't drink milk. Well, I would say don't drink milk anyway, because milk causes a lot of mucus and inflammation. And if you have an infection, the last thing you want is more inflammation. So wheat and dairy products, I always recommend you cut out anyway, but especially if you have an infection. But if you're doing milk, it can reduce absorption of certain types of antibiotics. So you can do it with water. Now, I have to laugh because sometimes the recommendation is, well, take it 2 hours away. Take the milk 2 hours away from taking your antibiotic. I'm going to go one step further and say, don't drink the milk or cheese or butter or ice cream. Why not just not do it at all? Unfortunately, in our society, we keep thinking, well, people drink milk, so if you're going to do it this way. No, if you want to get well, you have to make some changes because you wouldn't be wanting to get well because you would be well. And if you need to get well, you need to make some changes. So I would cut out the dairy products altogether. Now, I haven't had an animal product in 40 years. Now, one thing I learned over the years is that it's getting a lot easier to eat a healthy diet. But it's getting a lot harder to eat a healthy diet because there's so much more junk food or ultra-processed foods on the market. So be careful. I always say if you can't pronounce it, don't eat it. Read the label. If you can't pronounce it, don't eat it. There's so many healthy foods out there. Why would you eat the junk food? There's only one reason. The junk food tastes good. The ultra-processed foods taste good. They have salt, they have sugars or carbohydrates in them, they have fats in them. Monosodium glutamate is an excitotoxin to the brain, and it's a flavor enhancer. So there are scientists that sit around in a lab called food scientists, and they'll say, okay, what can I do to make this food more palatable, more tasty? And when we do, we create these hyper-palatable foods, foods that are so high in flavor that you kind of blow out. You get so excited by it, and then when you try something that isn't so hyper-palatable, you go, that's not as exciting. I'd much rather have those pink, chewy, orange things, whatever, because they're hyper-palatable. And it's just like a drug. The more you take, the more you want. And unfortunately, that's what's killing people. And like I said earlier, if you're just tuning in, if you're 65 or older, 89% of people 65 or older have taken a prescription medication in the past year. That's a lot. I haven't. So you don't have to. That's the whole thing. Because why do some people do it and some don't? The ones that don't are usually the ones that are healthy. So you don't have to take these medications if you're healthy in most cases. I'm not saying don't take medication. Thyroid medications. High fiber foods can block absorption. Calcium can block absorption. So take your thyroid meds on an empty stomach. And don't take them around iron either. Because if you take an iron supplement, you got to take it away from your thyroid medications as well. Now, sometimes there's genetic problems with thyroid issues. Graves' disease, Hashimoto's, these are issues. Now, those are autoimmune conditions. The body is attacking the thyroid. Now, sometimes in serious cases, you even need surgery. I'm not against that if you need it. But you have to understand that you have an autoimmune body. And if you have one autoimmune issue, chances are you're going to have others in a lifetime. Rheumatoid arthritis is an autoimmune disease. You're going to have other autoimmune issues if you don't take care of yourself. So once again, wheat and dairy, worst things for some of the worst things for autoimmune issues. Let's bring that inflammation down. So cut out the wheat, cut out the dairy, cut out those processed foods, and eat more fruits, vegetables, nuts, and seeds. Let's stabilize that immune system because, like I said, I was up at Lake Lanier, which is a lake in Atlanta, outside Atlanta, and my friends came to me one by one. I felt like I was the Pope, and they were going to have an audience with the Pope. I've got a hip issue. I need my shoulder replaced. I'm on high blood pressure medication. I have these problems. And every one of them said the same thing. Had I known when I was younger that it was going to lead to this, I wouldn't have done those things that led to this. And I say the same thing. I played football in high school. Not the smartest move I ever did. I have a fracture in my low back. I tore up my knee. Probably not a sport I should have played. Probably a sport a lot of people shouldn't play because you're going to get hurt. So you have to weigh the odds. Is it worth it? To me, it wasn't. I mean, if I'd gone on to college and got a scholarship and made it to the pros, all right, maybe. I played high school football for a little tiny school. And all I did was get hurt. It was not a good choice. Look, if I can go back and talk to my younger self, I'd say, listen, don't do that. Not a good choice. There's no benefit to doing this, only long-term harm. And if you have neck pain, back pain, shoulder pain, numbness, tingling, that probably means you have pinched nerves and bones are out of place. If bones are out of place, they will rub up against each other, they will wear out, and you will get arthritis, osteoarthritis. That's the only promise I'll ever give you. And I've been coaching now for 45 years. It's the only promise I'll ever give you is that if you have a bone out of place, you will get osteoarthritis, guaranteed 100%. So don't ignore that pain. Pain is telling you something's wrong. What can we do about it? Well, why don't we put the bone back in place? How's that for simple? And that's what we do in our offices. We have offices in Marietta, Duluth, and Stockbridge in the Atlanta area, and my team of doctors are really good at putting bones back in place, whether it's a spine, a hip, a shoulder, a knee, a skull, any of them. Put the bones back in place, and that oftentimes removes the pain. 90% of the time you have pinched nerves and don't know it, it removes those, and it prevents the bones from wearing out. How's that for a simple, easy, inexpensive fix? Really is. I wish I could make it harder for you, but it's not. It really isn't that difficult. So, anyway, I digress. Iron supplements, again, you want to take them away from thyroid medication, but you want to take them away from dairy as well because dairy can block the absorption of iron. So don't take iron supplements with food. Now, if you need iron supplements, absolutely take them. There's two types of iron supplements, heme and non-heme. Heme come from animals. Heme, like hematology, comes from blood, and non-heme comes from plants. I prefer the non-heme. The heme is easier to absorb, no doubt about that. But the non-heme, first of all, you're not eating animal blood, but second of all, long-term, I find you get better results with that. So it's a good idea to get your blood tested. Now, how can I get a free blood test to see if I have low iron? Here's your answer. Go donate blood. Go donate blood. They'll test your blood. If you have good hemoglobin, they'll say, yes, you can go. If it says no, you can't, then they won't let you. So it's a simple, easy, general screen. It's not going to test for a lot of in-depth blood tests. It's not going to go deep into the iron, but it's a good general screen. If it comes up, hey, I'm low in iron, I got to do something about it. Now, it could be a dietary issue. It could be that you're a woman of childbearing years. It could be you have bleeding inside your colon, and that's why you're anemic. It could be that you have low stomach acid, because stomach acid activates a chemical in your blood, in your stomach, to absorb vitamin B12. It's called intrinsic factor. So you need intrinsic factor, which is activated by stomach acid to absorb vitamin B12 to help produce blood cells. Maybe you're deficient in B12. Maybe you're on medication. How many of you, raise your hands, I can't see you. Raise your hands, how many people right now are taking acid reflux medication? A lot of you. You ever read the directions on that medication? It clearly says don't take, I think the most I've ever seen was 6 weeks, and then stop. How many of you have taken it for more than 6 weeks? How many of you have taken it for decades? If you lower your stomach acid, you're preventing the proper production of intrinsic factor to absorb B12, but you're not absorbing iron then either, and calcium and magnesium properly. So if you're taking an acid reflux medication, it's not so much food, you can go into malnutrition if you're not eating the right, if you're not fixing it. And many times with acid reflux, the stomach is pushed up against the diaphragm. What do? We pull the stomach down away from the diaphragm. Physically move the stomach. In many cases, acid reflux is a physical problem, not a chemical problem. I don't know how else to explain it. You can't, if the tires on my car are out of alignment, I can change the oil, which is a chemical issue, but the tires on the car are still out of alignment. It's good to change the oil, but you need to put the tires back in alignment. If you have acid reflux, heartburn, burping, gas, bloating, many times it's a physical problem. Could be a pinched nerve going to the area. Could be you have a high inflammatory diet like wheat and dairy products. It could be that you have bleeding in the colon. I mean, that's an extreme case, of course. So if you want to come see us, I would love to be your doctor. Wouldn't it be cool to have an analysis? Let's check the nervous system, digestive system, the diet. Let's put together a nutritional protocol. Let's find out what we need to do to get to the cause of your healthcare problems. So if you want to make an appointment, just go to my website, drjoe.com, drjoe.com. Normally, the first visit is $940. I've reduced that to $299 for you, my listeners. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. Why wouldn't you do that? Make the call. You can send an email too. drjoe.com. Let's try to get to the cause of your problem. Because I don't want you to be like so many of the people I was around last weekend who said, I wish I'd done something sooner. Why did I wait so long? I wish I hadn't done the things I did that caused these problems to occur. Every one of them. There wasn't one person there that didn't have a health issue when they came up to me and wanted to find out what they needed to do to fix it. Because as you get older, health becomes a lot more important. But you want to fix it early on in life. If you didn't fix it early on in life, it's never too late. So drjoe.com. And you send any questions you have through the website as well, drjoe.com. Happy to answer your questions. And I'll answer them personally. And it's my gift to you. I don't charge to answer questions. Now, I will tell you this. If you start sending me more than 2 or 3 questions, I'm going to say you got to make an appointment. Because if you have more than 2 or 3 questions, you're going to have a lot of health issues, and I can't just answer them on a quick email. So please don't take advantage of this courtesy, but also you may have a problem I can't fix. And if you send me a question on the website about our supplements and say, did these really work? I will chuckle. Because yes, everything on the website or supplements I've either created and or vetted, making sure they're the best of the best that I can find, and I take them. So if you're going to ask, does it work? The answer is yes, if you do it properly and you're consistent. Okay? Patient compliance is really big. One of my friends, Chris, she's a nurse practitioner, and we get together. Basically, we just talk about patient compliance issues. That patient didn't listen. That patient didn't take the medication like they were supposed to. That person didn't mix the food with the medication I told them not to. So you got to comply a little bit. You can't rely on us to do everything. You got to help us a little bit. So drjoe.com, great place to be. Now, I don't know if I need to tell you this, but if you're taking any type of sedatives, antidepressants, actually any drug, you want to stay away from alcohol. And I noticed that I was up on Lake Lanier. A lot of people drinking alcohol. In fact, somebody said to one of the guys who I didn't know, "This is Dr. Joe. He hasn't had a drink since he was 28 years old." And the guy looked at me with shock in his eye. "You what?" "Yeah, I don't drink." And of course, people say, "Well, we're an alcoholic." No, I wasn't an alcoholic. I just realized that there's no safe level of alcohol. Little alcohol, little damage, a lot of alcohol, a lot of damage. There's no safe level. But if you're going to do it, at least mitigate the damage from the alcohol. Take Dr. Joe's Super Greens. Take Dr. Joe's Essential Source. Take Dr. Joe's B Complex, which, by the way, you should be taking every day anyway. Take a second dose when you go out drinking. At least do that. And drink a lot of water. Try to mitigate the damage because you're hurting yourself. I know it's fun. You think it's fun, perceived fun. But once again, it's not worth the long-term effects of it. If it is to you, that's your call. I can't make you stop, but at least mitigate the damage. Super Green, Essential Source, and B Complex second dose. So antidepressants, if you have something called Flagell, which is a brand name, which can kill yeast in the body, every drug. Just don't do alcohol. I can go through list after list after list. The alcohol is just tearing you up. Diabetes medication. If you're on asthma medications, how many people take asthma medications? Well, you want to stay away from caffeine. Attention deficit disorder, caffeine, antibiotics, caffeine. But if you have asthma, you have to ask yourself a question, whatever your condition is. Why do I have it? What can I do to make it better? So I remember years ago when I first got in practice, I had a patient, and he was in a full-blown asthma attack. I mean, couldn't breathe. I thought he was going to die. He's gasping and grabbing at me, trying to grab air. So I put him down on my adjusting table, and I adjust his upper back, lower neck. It's called the C7-T1 area. And that's the nerve that goes into the bronchial tubes. And I adjusted it, and boy, pop. And he went, he's able to breathe instantly. Now, I'm not saying that's the only cause of asthma, but has anyone ever addressed the fact that maybe you have a pinched nerve going to your lungs? Probably not. Okay? So you always want to check the nerve supply to everything because the nerves control everything. Your heart, your lungs, your liver, your spleen, your thyroid, your sex organs, everything is controlled by the nerves. And the one common denominator is you got to get the nerve supply working, regardless of what treatment you do. If it's nutrition, if it's drugs, if it's herbs, if it's whatever it is, voodoo, whatever it is, you have to have the nerve supply working properly. And that's why I believe that if we had spinal evaluations, chiropractic evaluations on every patient ever, we would see a dramatic increase in whatever treatment they had. Whether it's surgery, whether it's drugs, whether it's nutrition, whatever it is, when you open up the nerve supply to the body works more efficiently and then receives whatever treatment it is much better. So we talked about ADD and ADHD and caffeine. It's overstimulation. What I've learned in my career is that ADD is a problem with the neurotransmitters in the brain. Okay, serotonin, dopamine, norepinephrine, GABA, those are the four big ones. But serotonin is a neurotransmitter that helps you focus, helps you calm down. Well, where is serotonin made? Serotonin is made in your gut. How is it made? When you eat a protein, whether that protein comes from a carrot or a steak, proteins are made up of about 20 amino acids. The amino acid tryptophan, if the protein is digested properly, combines with vitamin B6, you have to have enough vitamin B6, to create a chemical called 5-HTP, which then becomes serotonin. 95% of the serotonin is made in your gut. It travels up to your brain. It can go via the vagus nerve or go through the blood vessels. Goes into your brain, calms you down, helps you focus. Serotonin becomes melatonin, which helps you sleep. So if you have digestive issues, the chances are very good you're not breaking your proteins into amino acids to produce neurotransmitters, and you're not getting enough B6. So how do we fix that? Number one, we check to see if the stomach is up against the diaphragm. And if it is, we pull the stomach down away from the diaphragm. We get you on a methylated B complex. because certain B vitamins have to be converted into what's called a methylated form or the usable form. And it depends on the study you read, 40 to 60% of us can't methylate properly. And so you get a methylated B complex, you pull the stomach away from the diaphragm, you eat easy to digest proteins, stay away from the meats and the dairy products. Those are really hard on the digestive system. If you're probably over the age of 30, you probably want to take a digestive enzyme. I take digestive enzymes whenever I eat a cooked meal. If I eat a raw meal like a salad, no big deal. It has its enzymes in it already. But the cooked meals, you have to replace those enzymes. And at my age, I don't produce enzymes like I used to. So I get my stomach pulled away from my diaphragm if it's acting up. I take a B complex, a methylated B complex. I take a digestive enzyme if I eat cooked foods. And the results we've seen with ADD and ADHD are unbelievable. Phenomenal. They work so well in most cases. Now, sometimes there's other issues involved. I get that. I'm not saying that's the only issue. But if you fix the gut, get those B vitamins in your body, break the proteins into amino acids to produce the serotonin in your gut to send it to the brain, now the brain is able to start working. Because the drugs we give you for ADD utilize the little bit of serotonin that we have. What if we just made more serotonin? What a concept. And we do that by fixing the gut. So if you're on ADD drugs or antidepressants, you want to stay away from caffeine. But if we fix the gut, maybe we don't need those anymore. Same thing with antibiotics. You want to stay away from caffeine as well. So getting to the cause of the problem, not just treating the symptoms, is what we're talking about today. If you have Parkinson's, they say high-protein meals can be a problem if you're taking the drugs because it can prevent you from absorbing the drug. Well, here's the thing. Dopamine, L-Dopa, is given to people with Parkinson's to help control the shakes. 90% of your brain suppresses the other 10%. Isn't that crazy? So when that balance is off, you start getting the uncontrollable shakes, the Parkinson's, the tremors. And so we got to increase the dopamine levels in the brain. How do we do that? Well, fava beans and velvet beans are very high in dopamine, or the precursors to dopamine. And there's one study I read that if you take a dose of velvet beans specifically, was almost as effective as taking the medication. Wow. That's big news, isn't it? So fava beans and velvet beans you should be adding to your diet if you have Parkinson's issues. But you also want to fix the gut, because dopamine comes from the proteins and the amino acids being broken down. Tyrosine becomes dopamine. Tyrosine is an amino acid. Tyrosine becomes dopamine. Dopamine becomes norepinephrine, which gives you energy. So if we fix the gut, now we're breaking the proteins into amino acids. We have the tryptophan becoming serotonin. We have tyrosine become dopamine, become norepinephrine. Glutamine becomes GABA, which suppresses pain. Wow. What an interesting way to look at the body. What if we got the body working better? That's pretty cool. And then we start adding things like velvet beans and fava beans, can increase the dopamine levels as well. And then maybe, just maybe, you can talk to your doctor and say, hey, my tremors are much better because of my dietary changes. I got my stomach fixed. I'm on digestive enzymes when I eat cooked foods. Can I reduce my medication? And a good doctor is going to say, whatever you're doing, just keep doing it. I love when patients come in. I told my doctor I took Dr. Joe's nitric oxide support. My blood pressure dropped. I had more energy. My brain worked better. The doctors will say, well, whatever you're doing, just keep doing it. I never heard of that before, but just keep doing it. Well, that's okay. I'm fine with that if that's the approach. Antidepressants. Aged cheese, cured meats, fermented foods, soy sauce, beer, wine. Be careful with that. Antidepressants, you got to be really careful with. Now, with antidepressants, many times if we fix the gut, we start breaking the proteins into amino acids to produce the neurotransmitters, and the brain works better, and we can get you to reduce your antidepressants. I understand there are things that can cause depression, aside from food. Loss of a loved one, end of a relationship, losing your job. The older you get, the more, it seems like the more problems you have, right? Well, your family starts to die off, your friends start to die off, relationships may come to an end. And those are very stressful times to go through. So we want to fix the gut to produce the neurotransmitters to make the brain work better. And maybe, just maybe, we can reduce some of those medications. That's my goal. My goal is always get to the cause of the problem, not just treat the symptoms. You know, blood thinners, they'll tell you not to eat garlic because garlic thins the blood. Ginseng thins the blood, increases circulation. Dr. Joe's Energy Chewables has ginseng in it. Ginseng increases circulation, makes you feel good. And the citrulline converts into nitric oxide, which opens up your blood vessels, which helps lower your blood pressure, but also increases circulation to your brain. So we got to start thinking, wait a minute, maybe it's not the food affecting the drugs, maybe it's the drugs affecting the food. Different way to look at it. I'm not saying don't take the drugs. Please understand that. I'm saying if you can get the nervous system working, if you can get the digestive system working, if you can get the diet straightened out, if you can get on the right supplements, a lot of your health problems will start to decrease. Many of them will go away. Maybe not all, but many. So let's start making better food choices. Why not pick the best choice possible? Why not have something raw at every meal? Broccoli, cucumbers, tomatoes, avocados, fruits, vegetables. Take supplements. At least Super Green's an essential source, vitamin D3 with K2, and B complex. That's like the starter kit. I take nitric oxide in addition. I take men's hormone support. We have a women's hormone support as well. Because as I get older, my hormones aren't what they used to be. So I'll take the men's hormone support, which I love, by the way. I formulated it. And the women's hormone support. It's amazing. Omega-3 fatty acids, essential fatty acids, essential for brain function. So you have to get it from an outside source. It's essential. Why isn't that taken by everybody in the world? I don't know. All right, folks, I'm almost out of time. If you have any health questions, send them to me through the website, drjoe.com. I did not finish what I wanted to finish talking about today. So if you want a copy of today's show notes, absolutely free, send it to me. Send me an email through the website, drjoe.com, and just put food-drug interactions in the email. I will send you a copy of the show notes, absolutely free, my gift to you. All of our shows are archived on our website, drjoe.com. Go all the way to the bottom of the homepage. It says Dr. Joe Show. That's my live show where I do call-ins, and the podcast is the ones where I don't do call-ins. But you can listen to any show you want, anytime you want. Send me your questions through the website. Follow me on social media, Dr. Joe Esposito. We post every single day. And the podcast is Dr. Joe for the Health of It. Dr. Joe for the Health of It. Subscribe to my YouTube channel. Subscribe to the podcast. Follow me on social media. Let's get to the cause of your problems, not just treat the symptoms. Thanks for tuning in. Catch you next time. You have questions, Sean?
Does over-exercising cause protein to get into your urine?
Yes, it can. Absolutely. Yeah, under-exercising is bad. So is over-exercising. So be careful with that. Big problem with you. Yes. Okay. What else?
Steroids completely take away the itchiness between my fingers, but my doctor will not prescribe me anymore after the initial dose. Is that because steroids have negative side effects?
Absolutely. Yes. I mean, kudos to that doctor. Yay for him or her. Good job. But the challenge I find is the doctor didn't say, what else can I do, right? So what else can we do? Let's cut out the wheat and the dairy products. Itching is usually due, and skin issues are usually due to a liver issue. So cut out the wheat and the dairy products, and let's see what happens. Take Super Greens, essential source glutathione. It's on the website, drjoe.com. That can help the liver work more efficiently. Vitamin D3 and B complex. Super Green essential source, glutathione, D3, and B complex. And cut out the wheat and the dairy, and let's see if we can get to the cause of the itch. Because the steroids can cause really serious damage, and so kudos to the doctor for that. What else?
Are push-ups or bench pressing more effective?
I like push-ups better than bench pressing because you're using your own body weight. Bench pressing, I mean, you can push up in real world. You're not going to bench press in the real world. So I would do push-ups if I could. What else?
Do walnuts or avocados contain B12?
No. We got to be careful if you're eating a plant-based diet. B12 usually comes from bacteria eating rotting material. So meat, the reason meat has B12 in it is when the meat is slaughtered, as it ages, the bacteria start to eat the flesh and it produces B12. So they may have a little bit of B12 in it. Certain sea vegetables might have B12 in it as well. But as I eat a plant-based diet, I take a B12 methylcobalamin. That's the kind of B12 you want to take, not cyanocobalamin, methylcobalamin. I take that every day. We use it in Dr. Joe's Essential Source, and it's in Dr. Joe's B complex. So you're not going to get enough just taking vegetables and fruits.
Which foods are high in fiber and protein?
Gosh, lentils, split peas, beans, chickpeas, any type of bean or seed or legume, nuts, seeds. Those are great source of protein. Hemp, chia, Like I said, pea protein. Yeah, those are all high in protein. Yeah, and fiber.
What is your perfect meal from a health standpoint?
Oh, from a health standpoint, I was going to say my perfect meal would be what my mother made me for my birthday when I was a child. From a health standpoint, something raw. I like to have a salad at every meal, or something raw at every meal if I can. Gosh, there's so many. In fact, the first book I ever wrote, called Eating Right for the Health of It, has over 200 recipes in it. And I wrote that 20 years ago, I think it was. So, gosh, I don't. Perfect meal is so many of them. That's the thing. Is you could do a pesto with extra virgin organic olive oil, and you could put that over a gluten-free pasta if you want to go that way. Of course, salad is great. Avocado, mango, tomato, basil salad is probably one of my favorite foods in the world. It was even on a restaurant menu here for years in Atlanta. So yes, we have a question in the audience.
I'd say the perfect meal for any individual person is a meal that best addresses their individual health concerns.
There you go. Okay, Julia has the answer. Boom, she dropped the mic. She walks out. Find out what your specific health concerns are. So, if you have a thyroid issue, you want to stay away from wheat and dairy products and help build the immune system. If you have high blood pressure, you want to have foods that's high in nitric oxide. Beets, arugulas. So that's a very good answer. There you go. All right. What else, John?
That is all.
Well, thanks, guys. I appreciate it. Please follow me on social media. That's your homework. And any questions, send them to me through the website, drjoe.com, drjoe.com. And just become a patient.